related issues.
Yes, yes. So, sir, I'm sure the very first question everyone would like to know is, why did you become a doctor?
I didn't want to be a doctor initially. I wanted to be a computer scientist.
Yes.
I was very good at maths and science.
Yes.
So when I went to TEFLOP, the now University of Limpopo, in 1978,
Yes.
to do my first year,
Yes.
BSc, one of my friends, the late George Mugono, told me that no, if you do a BSc in computer science here in TEFLOP, it's going to take you 6 years. And it's a 3-year course, because somehow it seems people are failing or being failed there. So he told me I'll be wasting my time here. The best thing is to do my first year, we call it pre-med,
Yes.
and apply to the University of Natal at that time, and Medunsa was still new.
Yeah.
So he said that would be the easiest way, otherwise I'll be wasting time doing this computer science 3-year course for almost 6 years, or maybe even being excluded.
Yeah.
So that's how I became a doctor. I did enjoy medicine, in 79 when I was doing my second year. Very challenging, difficult field, because when you arrive there in second year, they give you bones, skeleton to study.
Yeah.
You have to sleep with the skeleton in your room. I mean, for the first time, you're alone in the room. You've got this bag of bones, so it's scary stuff. And then secondly, you have to start anatomy,
Yes.
where you dissect, cadavers and so on. So those were challenges. But, with perseverance, bravery, then you pass that hurdle and you go to the other years. But when I was in 6th year, last year, I lost interest in medicine.
Yes.
I realized that, this is not where I should be, but unfortunately it was too late. I just had to like the profession. And then, leaving the university, working in hospitals, meeting people, helping people, seeing people who come with, illnesses, children being bent and all these things. You help them, then, they become better. Eventually the love, came back. And I worked, did my internship at the Hook Hospital around 70 years in Limpopo. And then after that I went to Masana Hospital in the Bushbuck Ridge, in Mpumalanga, as a medical officer there. Very challenging place. We used to do 14 days call, I mean, people cannot believe that you can work for 14 days.
Non-stop?
Yes, non-stop. But initially, the first 2-3 months were difficult, but as time goes on, the body adjusted. So what is happening is that we're on a first call. First call, it means they call you for anything, anytime, at night, for 7 days. But when you're on second call, you assist the doctor who is on first call. Normally we give anesthetic, and then, assist here and there where there are problems. But you've got some little bit of rest, unlike the person who did the first call, After that, I came to Krugersdorp, Garissa, and opened my practice in 1986. Yeah. That's where I'm still today. I'm still in Krugersdorp.
And you're still practicing your
Still
medicine?
practicing medicine as general practitioner.
So how do you handle your emergencies there in your general practice, if they do happen?
Emergencies, I say solo practice is difficult to have everything, equipment and so on. But you'll have to have oxygen, you'll have to have some resuscitation equipment, like ambu bags, laryngoscopes, instrument to help people who are bleeding, suturing, stopping bleeding. People with acute asthma, you have to have a nebulizer.
Yes.
You have to have intravenous medication. People with allergy, anaphylaxis. You must have all the emergency equipment, because also if you are doing a procedure there and somebody gets anaphylaxis where they reacted to whatever medication you're giving, you need to resuscitate those people. Otherwise you shouldn't administer such medication or those procedures. So we do, except emergencies there, we do small procedures like male medical circumcisions, removal of small bumps on the skin like sebaceous cysts, lipomas. Before I used to do hemorrhoids and so on under local anesthetic, but since there are many doctors now where you can refer to, we're no more doing those things. Otherwise, it's more of managing diseases, trying to educate people about prevention of illnesses. Although South Africa mainly were more of a therapeutic orientated, medical field, but one need to remember prevention. Like the Cubans, their system is based more on prevention of illnesses, which is good. Waiting for an illness to happen and try to treat it is very expensive. Treating some cancers, very expensive, like lung cancer and so on. So if people, were educated about smoking, stopping smoking, improving the environment, pollutants, carcinogenic, pollutants and things you can eat, I think we can reduce the cancer rate in the country. Yes.
So a lot of people have been asking, what is HCPSA, what does it stand for, and what exactly does...
Health Professional Council of South Africa.
Yes,
their aim there is to protect, the public, while trying to maintain ethical conduct amongst its members, which are healthcare providers. Nurses, doctors, I think paramedics also do belong to the health, dentists and so on. So what they are doing there is to make sure you practice ethically, you do the right thing, you don't harm patients, you don't commit other, unethical things. And also for patients who feel they've been harmed by, healthcare providers, they can go there and lodge a complaint so that, they can get a fair hearing and a fair outcome. Because if you don't have the healthcare professional, I'm not saying healthcare providers will just mess up people, but at least it frightens people a bit to do the right thing, because you don't want to appear there. You can be struck off as a healthcare provider. You can also be fined, and nobody wants a bad name. It's just like a criminal record that you've appeared before the council.
Yes.
So that's in summary what the council is for.
And I want to ask the infamous question, even as a doctor, how much do interns earn in the modern day South Africa?
The
salaries.
I'm not quite sure now.
Yes.
But interns, are still students. They shouldn't really be earning, lots of money, but they should earn something which can help them to survive. Things are expensive now, but they shouldn't go there for money. They should then go to learn, and then when they are qualified, I'm sure they can start thinking of the money. when I was an intern in 1983, 84, our salary was 600 rand. Then it went to 900 rand. We belong to the homelands, you know. Homelands, we get 600. If you're working in the provincial government, which was, you know, South Africa, you get 900 rand. So we complained to the homeland government that no, we are equal, and these people are just our next door neighbor. But because they're in the what they call the republic, they earn 900. We are earning 600. We need an equal salary. Eventually,
Things
we
of
got 900, which was as an intern you could survive with that. My car installment was 80 rand per month. I mean, that was not bad.
It's very reasonable.
Yeah.
And how do you balance your medical profession, your extracurricular activities, and also your personal life over the years, from when you were still an intern till now?
You know, anybody who's saying a doctor can balance their life, there's no such a thing. If you're a doctor, something in your life is going to have to be sacrificed. You can't, it's impossible to balance your life, because if you are a surgeon or you know, any other, especially surgery, and then you say you are home now, you are having lunch with the family and everything, and then they call you that there is a patient who needs an operation and so on. You have to leave them immediately and go. I mean, they must remain and finish their supper or lunch. So it's difficult to balance. Also that, you know, our job is not like selling grocery, where you don't have an attachment, you know, to that grocery. But working with people, you have got that emotional feeling and attachment to them. And you always want to help, you know, with what, any time. So if you've got an understanding family, at least when you're home or when you're free, try to give them that quality time, be with them. You know, at least they will understand that it's not that you don't love your family. People say family first, and then job last. But this job is a different one. These people become family. The patients. That's why with, you know, if you look at my cards, business cards, they are not written doctor or service provider. They are written family doctor. Because almost these people, you know, you get used to them. You know, everybody in the family, children, those who are coming later, grandchildren, and so on. So you just become one family. So medical practice can become your extended family. Yeah.
And then for every single person who wants to become a doctor or in allied health services, what advice would you give them?
If you want to do this job, you must be respectful. Number 2, you must love to work with people. Number 3, you must have patience. And number 4, you must be a good listener. Number 5, you know, you must take any nonsense.
In what sense?
Patients come there and with their own problems elsewhere. Then they come and, you know, offload them to you. Sometimes it became rude to you. But it is not necessary to become rude with patients, because you are not going to spend the whole day with them, maybe 30 minutes to an hour. Just, you know, control yourself. So if you don't have those qualities, I think you better maybe go and try the taxi industry. You know. So working with people need that patience, because some people come with a person will come that, no, we're fighting for a house at home. My parents have died, it's my brothers and uncle. So and so want to take the house. But this has got nothing to do with the medical But people will come to the doctor for such, problems. And you can't turn them away. You have to listen and try to use your own common knowledge, a little bit of law, and then put them together. Eventually, they will listen to you and realize that what you're telling them is really, reconciliatory. It's not, you don't want to divide them, you want to build them together and tell them the truth. Reality that, this house maybe should draft a contract or some kind of agreement where all the beneficiaries will be stated, and then, you work on that. And unlike saying, hey, this house belongs to my uncle and so on. Sometimes you get people who have been fired from work, especially domestic workers, coming to you that they've been fired from work and so on. So they want you to help them. I mean, that's really not, it's a labor relation problem. But eventually you'll have to listen to their story, and as an employer, the labor laws. And then you'll have to approach these employers of these domestic workers and try to speak to them. Some of them will be rude initially that, why is the doctor getting into this problem? But through perseverance and, not becoming emotional, eventually they respect you and agree that, look, this person has been working here with us for 20, 30 years. What we are expelling them for is not really, a very, very huge misconduct. And then although the relationship now is gone, it's difficult to get this person back, especially, domestic working means you are too close. I mean, you share the same environment most of the time. So eventually the employer will just settle and give them something at least, rather than to get them off without anything.
So over the very long career that you've had, over your 20 plus years, what has been your worst medical experience with a patient?
The worst medical experience with a patient, it was the time when we used to have this penicillin, they call it procaine penicillin. It was an injection to treat many infections. That thing, sometimes people react and they get anaphylaxis where they collapse and things can be bad. Sometimes they do react to the procaine part of this injection, and then they start hallucinating, especially visual hallucination, where they are seeing very frightening things. So a patient like that can really mess up your day, because they are running around in the whole practice and injuring themselves, screaming, and you're trying to hold them down, and they are seeing all these snakes and frightening things. So those are some of the things. So although eventually you'll have to give them some injection to calm them down, like sedatives like Valium and so on. But as a young doctor, this can really discourage you, thinking that maybe patient will leave and say, look at that doctor, patient got mad then. And the other thing is, when they get an anaphylaxis here, the blood pressure goes down, they collapse. You need to have some resuscitation equipment, so that can frighten you, because if they die, I mean, it's something which you need to explain what happened. So those were the challenges which I think were a bit of the worst. But there are other minor problems where a patient comes in and they are sick and they're already gasping, and they just died there before you could do anything. Those are.
And how do you deal with some doctors' egos? Because I'm sure they're very overconfident people who don't necessarily want to listen to the people who've done it over the years. They believe they're right.
I think principles must come before personalities. There are people who just, they are not good people, but they might be doctors and other, healthcare provider. They might have, there are, of course, those who've got bad relationship between themselves, their patients, and sometimes the staff. And then, of course, you can get some of the doctors who are very heroic and so on, and bravery, who can do certain things, I mean, in a limited setup like a general practice, but sometimes you have to be having some sort of some mild mental illness, I mean, like somebody who will try to do a laparotomy in the surgery through a local anesthetic, I mean, that's bravery, but I think it must be some kind of mental illness. Yeah.
Okay. Thank you very much, sir, for your interview and the knowledge that you have given us, and I hope this interview will help everyone else to understand the medical side of life.
Yeah, thank you, Pongani. Young graduates, the matriculants who want to branch into medicine, you must love people and you must respect people. And people think that doctors make a lot of money and so on. That's not true. Money, of course, will come, but shouldn't be a focus. Money should be a secondary thing. You should focus on helping people, being happy, enjoying the job. If I get into work, I mean, I know my patient very well, and I don't have a lot of stress. I enjoy myself because I speak to them, ask them about the family, their work, which team they favor, so sometimes their team is lost, and we'll be joking about that, teasing one another. So by the time we leave work, I mean, you forgot that you have such a stressful job as a doctor. So people should have that interpersonal relationship